Hello. Have you ever heard the phrase palliative care and wondered what that meant? Palliative care is the medical specialty that focuses on relieving pain, anxiety, and other symptoms related to long-term serious illnesses. Some of those serious illnesses can include cancer, heart disease, Parkinson's disease, Alzheimer's, and many other conditions. Many hospitals, including Medical Center Hospital, have palliative care programs for their hospitalized patients.
My grandmother has been in the hospital a really long time and doesn't seem to be getting any better. We don't know if she can be healed. What else can we do?
Hello, I'm Dr. Don McClary. I and Dr. Chow Lei are the two physician leaders for the inpatient palliative care team here at Medical Center Hospital. It's my honor to be able to introduce you to our palliative care team and the palliative care concept. The doctor who's caring for you or your loved one here at Medical Center Hospital can get the palliative care team involved, especially if there's signs of pain, other types of suffering that's very complicated. Because that's what we specialize in, is in dealing with complicated signs of suffering, pain, shortness of breath, nausea, other problems.
Our palliative care team is an interdisciplinary team. We have physicians, a nurse practitioner, nurses, social workers, and chaplains, along with respiratory therapists, physical therapists, and pharmacists. It's a team approach that involves taking care of the physical, emotional, and spiritual needs of our patients and their families.
We work in partnership with the physicians on the case, and we can be as involved as necessary. We can provide a one-time consult, we can provide cooperative care, or we can sometimes take over a patient and have them on our palliative care service primarily. Again, we do three major things. We deal with signs and symptoms that affect quality of life, pain, shortness of breath, and others. We communicate with the patients and their families, and we help care for them in spiritual ways and social ways.
In addition to our team approach, Medical Center Hospital has dedicated 4 of our larger rooms on 5 Central to be dedicated to our palliative care patients and their families. We have also dedicated a consultation room on 5 Central so that we can have meaningful conversations with our families.
You might be wondering, okay, this sounds like hospice care, right? How is palliative care different from hospice care? There are some similarities but significant differences. Hospice care deals with people who are terminally ill, in fact, who have a limited amount of time to live. We're not limited by that. We can take care of people even when they're not terminally ill. In fact, that's what we focus on, is people who aren't acutely dying. Another difference is that palliative care can be given along with curative treatments, whereas hospice care is often focused mainly on quality of life and no curative treatments because there's no cure available. With palliative care, there still may be a cure, but we're focusing in a major way on quality of life and improving that until other things get better. There are a few myths about palliative care that I would like to address. Myth number 1, a lot of people feel like if you get palliative care involved, that means you're giving up. Actually, it's not that. I don't ask people to give up anything, ever, except maybe one thing. And sometimes we have people who are falsely hoping for something that's just not able to happen. And so sometimes we confront that. But actually, we're more about giving hope than talking about giving up. Myth number 2, palliative care means that we're not going to do any more treatment for you. That's absolutely false. I don't want you to have the impression that, oh, there's no more that we can do for you. There's always something that we can do for you or your loved one. It may not be in the same vein as we were thinking at the beginning, but there's always something we can do to improve your quality of life, to reduce symptoms, and hopefully to deal with the disease also. Myth number 3, you can only get on palliative care if you have cancer. Actually, palliative care is for almost any type of illness that is a chronic and difficult to deal with illness. We take care of people with heart disease, myasthenia gravis, multiple sclerosis, muscular dystrophy, lung disease like emphysema, kidney failure, liver failure. We can take care of almost any type of person who's suffering symptoms that need to get managed. Myth number 4, palliative care is for oldsters, old people. Actually, palliative care is for everybody. From birth to death, you can experience a problem where you're having difficulty with pain or other symptoms. And that's what we deal with. So we're not limited by age, although many of our people are elderly because that's most of the people who are in the hospital. We deal with anybody.
How can you contact the palliative care team at Medical Center Hospital? Speak with your loved one's physician. He or she can contact the palliative care team to come and evaluate your loved one and make recommendations. Our physician champions will evaluate and assess your loved one and then follow up with your primary care physician.
So, if you or your loved one are facing a serious illness, ask your doctor about contacting us at the palliative care team.